Hi, everyone. I'm Tenley Snow, Communications Director for Cooper Smith, joining you from Missoula, Montana. Thank you for the chance to join the 2021 Global Digital Development Summit alongside so many esteemed colleagues.
And hello, my name is Taonga Chilalika, joining you from Johannesburg, South Africa. I'm pleased to join you all today to share an exciting new partnership between PATH and Cooper Smith. Just as the Global Digital Development Summit originated to bring together leaders from across the health and development sectors to meet and learn from one another, the dual partnership exemplifies a commitment to reflecting a country experience within the growing evidence base for digital health programming. The dual partnership closely supports this year's summit theme, Impact First, by gathering real evidence on what works and what doesn't in digital development. We can see the potential of digital and data use all around us, from the use of digital systems to aid in disease surveillance, to the application of electronic immunization registries, to schedule vaccine sessions. And it becomes all the more relevant as the world grapples with a global pandemic. Use of routine health systems data can help to understand and curb the developing impact of COVID-19. At the same time, healthcare practitioners and ministries of health have learned many important lessons about what makes the development and introduction of digital health solutions and data use practices likely to succeed. But even as countries are increasingly using digital tools and instilling a culture of data use to better achieve health for their citizens, there's often a gap between the people designing these digital systems, the local stakeholders implementing them, and the funders and policymakers defining digital health standards and guidelines, resulting in missed opportunities for impact. The Data Use Acceleration and Learning Project aims to accelerate the scale and impact of digital health solutions by collecting, synthesizing, and sharing learnings from 5 countries digitally transforming their health systems through the better use of data. Burkina Faso, Ethiopia, Malawi, South Africa, and Tanzania have received funding from the Bill and Melinda Gates Foundation and support from implementing partners to systematically digitalize healthcare and strengthen the use of health data to achieve better health outcomes. Based on findings from DUAL's 5 focal countries, we're working to develop a model for digital transformation for data use that will enable other countries to replicate their success and best practices. This model will be shared with governments, implementers, policymakers, and funders to better align financing, normative guidance, and pragmatic approaches for digital health.
Thanks for that great background, Tonga. DUAL's model has been developed using a participatory research process that invites a wide range of stakeholders to contribute their learnings, whether they are investors funding digital health programming or implementers designing more impactful software platforms. Instead of the subjects of traditional research, participatory research collaborates with different stakeholders and end users in the research process. Over the last decade, researchers across disciplines have taken a more democratic approach to research that engages all types of stakeholders, including patients, youth, and individuals from marginalized communities, to have active roles in the research process, ensuring that it's relevant and translational in their lives. By applying participatory research design, DUAL will more meaningfully engage stakeholders in its research, in turn, creating more relevant and meaningful findings that can be translated into action.
Thank you, Tenley. Key to this participatory research process has been the development of an implementation framework to inform the evidence gathering process and define the core components of a model for digital transformation for data use. Our implementation framework builds upon existing global and normative guidance, such as the WHO ITU eHealth strategy building blocks. Whereas current frameworks and models are often high level and do not account for country experiences and lessons, DUAL's implementation framework focuses on all the components required to digitalize a health system. from the health workforce to financing and change management approaches so that countries can adapt and apply lessons to their unique health landscapes. The implementation framework was developed by reviewing common themes across 36 existing models, frameworks, and guidance documents related to data use, digital health, and health information systems to determine where there are commonalities and where there are gaps. DUAL will then apply this implementation framework to guide a participatory research process that aims to center the experiences of countries implementing digital health solutions in 2 key research phases. A comprehensive document review helped to determine key themes within the current evidence base from our 5 focal countries. Following this, DUAL has started the second phase of data collection, which will use participatory data collection processes to invite country leaders and digital health experts to contribute to a model for digital transformation. Using key informant interviews and country discussions, we will collect and synthesize country lessons to determine the critical factors for digital transformation. Throughout our research process, we will engage key stakeholder groups representing country governments, policymakers, funders, and implementers to validate findings and make sure they resonate with the many different players involved in digital programming. An initial group of technical experts will be consulted early to help define lessons, best practices, and the critical factors to achieving digital transformation within country health systems. A second advisory group composed of senior leaders from country governments, technical experts, and digital and data champions will play an important strategic role to validate and socialize country learnings.
Thanks, Tonga. DUAL will distill critical success factors, tools, and approaches from these countries, focusing on the components that lead to sustainable, country-driven digital health programming and data use practices. By documenting, sharing, and reflecting country learnings, we will advocate for changes to digital health financing, policy, and implementation to better align with DUAL's model. We envision a future in which all digital health stakeholders work systematically and in collaboration with one another to help countries digitally transform their health systems in keeping with their health targets, digital maturity, and current best practices, thereby saving lives and improving the health of people around the world. As leaders in your field, we invite you to join us in our efforts. If you'd like to get involved, reach out to us at dual@path.org. It's been a real pleasure presenting with Tonga and colleagues from PATH, and we wish you the best for the rest of the conference. Thank you.